So welcome to the webinar, Telemedicine Options for Substance Abuse and Eating Disorders. We'll go ahead and start with introductions. So Vicki, I'll turn it over to you.
Hi, thanks. I'm Dr. Vicki Berkus. I am the Medical Director for the Eating Disorder Program at Bright Heart Health. I'm also a medical consultant for Bermuda Ranch. Hi guys, if you're watching. And am in Wickenburg, America at the moment. I'm thrilled to be here. I've been in the field of eating disorders for 25 years and have worked both inpatient, outpatient, IOP, PHP. So I've sort of had an experience with all levels of treatment. So I'll be happy to answer questions individually after the program, and we will leave you ways to submit any questions you have for me after the program.
Great. And Vicki, where is Wickenburg? So people
Wickenburg is an hour north of Phoenix, Arizona.
There you go.
So yeah, the home of the Meadows, Bermuda Ranch, and Rosewood. Three treatment centers in a little town.
Excellent. All right, Helena.
Hi, everybody. My name is Helena Rouhe. I'm a licensed marriage and family therapist, and I live in Coeur d'Alene, Idaho. We're in the north part of Idaho, just 90 miles south of the Canadian border. I came here 3 years ago from Southern California. I'm an experiential therapist, and in my picture is not a cow, but a horse. And so I use horses in therapy, and I'm advanced certified in the GALA model. I also happen to be on the GALA board. I've been working with substance abuse for about 12 years and with eating disorders for about 5. And I'm happy to be here today. I'm also your CE provider. So those of you who are licensed marriage and family therapists, LCSW and the like, you will be getting a one CE clock hour today. Unfortunately, for those of you watching the recording, at this point, I'm not available to be able to provide that CE, but it is coming soon. So thank you so much for joining us.
Thank you. Helena, can you turn your volume down just a little? Am I the only one hearing you screaming?
Just you, Vicki.
Okay, never mind. Sorry.
That's all right. And that actually brings up a good point, Helena. So we're scheduled this presentation for an hour, and we will have the recording up, but plan on seeing more of these from us. So that's excellent. I'm glad that we're able to provide that. All right, and then just to introduce myself, Jonathan Ciampi, and part of Bright Heart here with this fantastic team. And so I've been working in this field now for a little over 5 years, and excited about the opportunities with telemedicine. So wanted to share a lot of that with you, and we'll go ahead and get into the meat of this. So I think there's a couple things that we're going to cover today that's important, but if you go back in time, and I used to always have this conversation in high school and then in college, you could assess people at sort of where they were in time with technology based on whether or not they saw Star Wars, the original Star Wars, in the movie theater. If you ask someone, hey, were you old enough to see Star Wars in the movie theater? It tells you really quickly whether or not they were pre-email or post-email. You know, if you saw Star Wars in the movie theater, then chances are you were in, you know, your late teens, 20s, coming up through the 90s, and that's when email started to really come around. At least that's when I certainly paid attention to it in 94, 95, and all that time period. And what's interesting is telemedicine right now is hot. It's amazing how much discussion is happening out there around telemedicine. You have certain companies like Teladoc and MD Live and a few others that are doing primary care type of capabilities out to individuals. You're seeing Blue Cross Blue Shield, Anthem, Aetna, Magellan start to integrate telemedicine into their plans in terms of putting it on the cards. You actually will get on the insurance card, it will say, here's your Teladoc number. This is a part of your benefits package. And you're seeing organizations, whether it be large corporate, you know, Fortune 100 or Fortune 500 companies, all the way down to small organizations, identifying that telemedicine is a benefit to their members or to their employees. And so what's exciting about this is seeing the growth rates. And I live out in California. I didn't comment on that. I live just east of Silicon Valley, or east of San Francisco. And most of the time, all I hear about is Facebook, Twitter, Airbnb, Uber. And you think about, I'll go back to why I brought up Star Wars. When you think about how technology has changed the way we live, it's been somewhat slow from a consumer standpoint or a patient standpoint to see that actually take effect in their lives in the medical world or the healthcare world. But now we're starting to see that become explosive, and we're seeing a lot of this talk in Silicon Valley. I would say it's still very early, but you're starting to see this conversation happen in the healthcare space and technology being brought out to the masses. So certainly it's been done on the back end, but now we're starting to see it much more. And so I think this presentation is going to be very helpful in the sense of demystifying some of the advantages of telemedicine, but also bringing to light the advantages. And I would want to comment right away, this is not an or situation. We are not saying that telemedicine is better than in person. We are not trying to say that people should stop going to see people in person or that the end of seeing physicians or therapists is on the horizon. Instead, what we're saying is just like you can buy shoes on Amazon, or you can go down to Macy's or the mall or your shoe store, there are advantages to buying it on Amazon, and there are advantages to going to Macy's. And so depending on what the needs are of the patient or the client, depending on the needs or the capabilities of the provider, telemedicine is a great opportunity. And so that's all we're trying to do with this. Keeping that in mind, here's the agenda. Obvious benefits of telemedicine. I think this is going to be rather obvious for everyone and simple to go through, but I don't think it actually hits home until you start to put it all together and put it into practice. Then Vicky's going to take over looking at the less obvious benefits of telemedicine. This gets into the nuances. You know, if somebody's looking at creating a telemedicine private practice, or you're looking at doing anything in telemedicine, pay attention in this area, because the obvious benefits will smack you in the head, but the not less obvious benefits, you're going to need to consider them and want to think about them. And some of them are advantages, and some of the ones are areas that you're going to want to be cautious around and think about what you want to do there. And then the last piece is what I think is the most exciting, and that's where Helena is going to jump in and talk about telemedicine treatment, and in particular, capabilities that telemedicine enables that are difficult to do in the physical world, but rather easy in the virtual world, if you want, or in the telemedicine world, or as I like to call it, because I heard this term and I thought it was interesting, I'd never heard it before, in the digitally native environment, okay? So again, if you saw Star Wars in the movie theater, you are a digital immigrant, meaning that you did not grow up with technologies and smartphones in your hands. If you are a digital native person, it means that you grew up in a world where that was all capable. In a telemedicine environment, you're digitally native because everything's done through technology. So we'll go ahead and get into that. So obvious benefits. I mean, they're simple, they're straightforward. Flexibility. Right now, we have 3 individuals who are meeting with you from around the country. Many of you are coming from different parts of the country, some of you internationally. So flexibility in location, flexibility in time. You're no longer restricted. Experts, bringing experts together, and then convenience. They're obvious, but let's go through some of the details. One of the things that we've noticed in telemedicine that becomes an advantage from the provider standpoint as well as the client standpoint is the ability to schedule meetings with your clients when you are available. And most people think, well, I'm available when I get to the office. That may be, but that also may not be the case. We have a dietitian on our team who meets with a lot of her clients on Saturdays. That's her day that she uses. It's the day that she is allowed, based on her schedule, family conflicts, work conflicts, soccer games, whatever, that she knows she has this block of hours. Now, she doesn't need to go into an office. She can go right into one of her rooms, has privacy, professional, be able to engage with clients. So that is a big piece. The other one is when a client is having or struggling with a situation and they reach out to you, you're no longer constrained to a phone call. Client struggling, needs to talk to you, you get on the phone. Instead, you can actually see them. Big difference, huge difference sometimes, being able to see somebody and interact with them. And then the other piece that I'll call out with Vicky, she's got her pup right there. You see her, pup's on the screen, she's comfortable, she's safe, she's feeling in control. And so it's an intimate, private session. And you're not requiring your client to get out and travel. and you are also in an intimate private setting. So it creates this engagement model, and we'll get into more of the details around that, but the flexibility, these are all the things around the flexibility that make it super powerful. The second one that I think is obvious, but people don't think about too much, is the availability of experts. And whenever you think about your particular local area, take the town, city you live in, oftentimes getting experts is difficult. There's just not enough of them. And there may be people who are trained, but maybe you need somebody who is trained in 2 areas or 2 specialties. With telemedicine, you're really freed from a lot of the geographic restrictions that you have in the in-person world. So you can bring together a trauma expert. I'll use the case of therapy. You can bring together a trauma expert and maybe an addiction expert and put them together with a client. You can bring together an MD and a therapist who would, in normal world, would have 2 physical different locations. In a telemedicine world, just like we are here, you have an administrator, which is myself, you have a physician, which is Vicky, and you have a therapist, which is Helena, all on the same screen together. And so you really are able to provide that capability. Now, one of the questions that comes up, and this has come up since the day we started this company, was, well, what about laws, in particular licensure laws? And I will give you the straightforward answer. You must be licensed in the state where the patient resides to provide them treatment. There's no way of getting around it. I often get this question, how do you get around the licensure laws? We don't get around the licensure laws. We work within the licensure laws. The licensure laws are, right now, the way they are stated across the United States is that you have to be licensed in the state of the patient. So that doesn't mean that telemedicine doesn't provide an advantage. It just means that that's one of the barriers or regulations that you have to work within and work around. Meaning, if I have a client in California, I need California people. That's simple. So that's a question that I wanted to make sure we addressed. And then the last one is just convenience. Convenience in terms of technology. I think almost everybody in the world now seems to have one of these things called a smartphone. I have my iPhone. I actually shattered my screen recently, so it'll be a new iPhone soon. But you can get on with a phone, and most of you are probably joining from your computer, but if you had a tablet, you could join that way. You can do it while you're on the road, if you're traveling, if you're going international, at home, at work, doesn't matter. All of these provide that convenience. The convenience knowing that my schedule and what is going on in my life doesn't necessarily impede my ability to get care. And that is important. So convenience equals access to care. So those are the obvious benefits. And if you have questions, I'll just point out as we're going through this, on your screen, you should have a Q&A or ability to ask questions. Go ahead and enter them there. We'll take them at the end. We'll go ahead and go through those, but just wanted to point that out. So let's move on to the next section, which is the less obvious benefits. And Vicki, I'll turn it over to you at this point.
Thanks, John. I just want to say, yes, bringing in the experts. These are my expert puppies, and we do a lot of therapy, and sometimes I use them when I'm working with clients on telemedicine. But the less obvious benefits, the frequency of contact. I just left a position where I was an inpatient medical director for an inpatient unit. I also covered the ER. I did consults all over the hospital, and I had an outpatient practice. Now, if a patient was in crisis or needed to talk to me, it was sort of hard to get hold of me. I mean, even though I have my iPhone and my screen is fine, thanks, John. No anger management here. Anyway, what I'm saying is that, yeah, I wanted to be there for my patients. But the fact that I had so many hats I was wearing and my days were so busy, I couldn't provide the same kind of contact that I do now. And people don't realize that are professionals, and people don't realize that are patients. Think about it as a patient. If I am going to see my doctor, I have to get in the car, I have to cancel my schedule at work, I have to take in the travel time, I have to make it to the appointment, I have to hope that they're on time to see me, and then get back to work and see what I've missed and play catch up at that point. So telemedicine has offered me as a provider a much more frequent way to contact my patients. They know they can email me anytime at my Bright Heart address. They know they can call their therapist, they can call John and tell them they need a call back from me ASAP. And I get that message immediately. So it's a much more frequent type of contact. Not only do I see them in a one-to-one for a psychiatric evaluation, but I join a group once a month called Life Skills, and I'm open to medical questions. I'm open to individual questions about how they're feeling, their mood, their medications. And I can call them anytime at home and visually see them. So that's one of the things I had to learn once I started to practice telemedicine. The safety and privacy, patients, again, have to be taught that no, they can't stand in the middle of a party and talk to you. They can't have their family around or their children. So we set very strict guidelines, and we have policies and procedures around safety and privacy. And I did the same thing in terms of my location. I'm not going to talk to someone on my iPhone in the middle of a unit or the middle of an office. I'm going to make sure that I have a place where no one overhears our sessions, and it is private. So again, there's considerations on both sides of the therapeutic alliance as to what's going to help our patient the most. And the medical considerations. You know, I think all of us have worked hard to reach our level of expertise, and we don't want to sabotage or jeopardize those licensures. So I have the same medical considerations I have for an IOP level, whether I'm doing it face-to-face or I'm doing it through telemedicine. And we will go through a series of screenings where I am either able to talk to the client's PCP or psychiatrist or therapist, or I can look at the lab online. We have a full medical record system that has access from all of our team. And I can make sure that if I have any concerns with that patient's medical status at the time, and I feel they are too acute for our system, we take that as a team, we talk about it, and we make sure that we get them to a higher level of care. They know that when they come in the door, I'm going to send them a letter to take with them to their primary care provider to make sure I have all the laboratory tests required for someone with an eating disorder. They have to sign an agreement, they have to sign releases, just like they would if they were coming into my private outpatient office. So everything that I do in an outpatient office is very similar to what I can do in telemedicine. And you might be thinking, well, gee, you can't do hands-on, and you're right. But you know what, just as I was in my office and I would look out and go to greet each patient, their treatment started the minute they walked in the door and I saw them interact, or I could listen, I have big ears, I could listen to them in the waiting room and see how they interacted with my staff, how they interacted with one another in the waiting room, where they chose to sit, what's around them, what are they wearing, what's comfortable, and I can do a lot of that on telemedicine. And it's a nice way sometimes to break the ice by asking a picture that's behind them or an animal that's sitting on their lap, and we have an immediate connection. So think about your questions about medical considerations, and I'll be happy to answer questions afterwards.
Great. Thanks, Ricky.
Sure, go ahead.
No, keep going.
Okay.
I was just flipping the slide for you.
Yeah, the partial interventions is that if a patient's having a med reaction, they have a much easier route to getting my attention than they would if I was office-based or hospital-based. I can get an email or a call from them directly. I can look at a rash on screen. If they have a rash, I can see if they're swelling. I can look for water in terms of an edematous area, whether it's on the face, on the cheeks, on the legs. And this is so convenient for me, as opposed to rushing to an office or rushing to an emergency room to make sure that my patient is getting the best care that I can give them. So it's very nice if you're a therapist, if you're a nutritionist, if you're a physician, if you're a CEO, if you're a person that's helping making contacts and doctor's appointments on the outside, we can reach out to each other several times a day without it being burdensome to our other activities during the day. So that's a real plus as far as I'm concerned. And I'm just thrilled at how open people's providers are to talking to me and learning about telemedicine. So not only do I get to get information about my patient, I also get a chance to educate those providers that have never worked on telemedicine before. When I see my patients, you know, it took me a while to realize that even though there's a lot of similarities in talking face-to-face to someone on the screen, for example, all of you are seeing me now, and you can hear me and you can see, you know, I can show you the pups if I want to show you the pups. I can show you my surroundings if I want to show you the surroundings. But one thing that's nice is that, think about it. If you have those patients that are binge eating disorder patients or have weight issues, when I would see them in my office, and I did a lot of groups for compulsive overeaters, they would struggle to get up to the second floor. And I could see their anxiety increase as they looked to see if there's a chair big enough in my waiting room, which there was, because I worked with bariatric patients. They also, again, would later let me know that, Dr. Berkus, most of my thoughts coming into your office were you watching my body? Could I sit down gracefully on the couch? Would I be short of breath? What would you be thinking about my body? And a lot of patients, if they knew they were going to be late in a group, wouldn't show up because of that fear of that number. And so if I can meet with someone on their own turf and they're safe, they maybe have their favorite blanket, they're in their bedroom or they're in their living room, and they know that unless I ask them, we're going to be talking face to face. They're not going to be looking at my body with the thoughts they have. I'm not going to be looking at their body 24/7 or throughout the whole interview. And they know for maybe once in their lives interacting with a professional, they're having the eye-to-eye contact that makes them so much more comfortable than having to be in their body having the interview. I see the anxiety get lowered. I see their ability to get to sensitive issues more quickly. And again, if they need to step away and get a drink, if they need to stretch, if they need to comfort themselves with their pet, they have that opportunity. And I can be there talking them right through that situation. So I think that the feeling safe and private is a big surprise for me dealing with our clients in the telemedicine arena. Safety. People say, well, why aren't you concerned? Sure, I'm always concerned when I'm dealing with a patient. No two people are alike, and we've noticed in our field that the acuity is going up on rapidly. And I'm shocked at what I see coming in on an outpatient basis, while I expected to see that level of acuity in an inpatient basis. So I think we're all faced with the patient that has multiple needs, multiple concerns, and multiple diagnoses. So my concerns are the same as I would having someone come to my outpatient IOP face-to-face. If they have suicidal ideation or they're homicidal or they're psychotic, I'm not going to feel that they're comfortable in this setting, and I'm not going to feel comfortable treating in a setting where we don't have more support and control over their behaviors. So again, the concerns are any concerns I'd have for an outpatient program. Safety is the same thing. I wondered when I started telemedicine would I have as much information about my patient as I would if I was in an office controlling my medical record and what information came in and out. And I'm pleasantly surprised. We're JACO certified, and for those of you that have ever been through a JACO review, you know that we have to have procedures and policies for every aspect of treating patients with eating disorders. We have policies and procedures for getting weights. We have procedures for getting measurements. And you say, well, how can you do that in a telemedicine setting? We have worked out a system where either the patient can get their weight done with the online nutritionist or therapist. They can go to their private primary care provider or nurse practitioner and have it done there and have the results sent to us. Or they can have someone that's working with them in their recovery in their home, work with one of our staff to provide accurate weights. And we do blind weights so that, again, any issues that are coming up about numbers are dealt with in their group and in a one-to-one session. Management and drug screening, I can be as cautious as I want to be. If I want Depakote levels, if I want lithium levels, if I want blood counts, everything can be done in this day and age through overnight faxability. The patients understand that they're agreeing to get what we ask them to get, and we work with their insurance companies to make sure that we don't induce hardships for the patient. So I think that the random look screening, the blood counts, any tests that I feel I need are just as easy to provide for my patient as it is if I was seeing them on an outpatient basis. And our next slide, monitoring online. A drug test is, for those of you that haven't worked in the substance abuse area, and I have through my years at different treatment centers, a lot of times we do random drug tests, which means that they get a code or a number and the lab will call them when randomly it's their turn to drop a urine. There's very strict restrictions on once they walk in the door of the lab, they're always in line of sight and how this is done. Same thing happens on telemedicine. They know where they have to go, they have their lab slip, they know exactly what's expected, and so we can do the same test for substance abuse that I can do if I think someone's purging and I ask for an amylase, or I ask for a specific gravity on a urine to see if they're water loading. All these things can happen on a telemedicine basis. And I've gone through the weights. And again, patients feel a lot better sometimes knowing they're not going to be weighed as part of a group or part of a session, or we're not going to do a group immediately on that number, but yet they know they're free to bring it up in any individual session with their nutritionist, their therapist, with me, or with their group sessions. So I have a nice safety net as a physician treating them and as their psychiatrist, knowing that I can ask for old records, I can ask for old lab results, I can talk to anybody that they've seen with their releases signed. And the red flags I've come to look for are, again, the acuity. How many ER visits have they had in the last week or 2 weeks for electrolyte imbalances? How often are they seeing their physician? How many times do they get dizzy and faint during the day? That's why we include the family, we include the professional staff that they have at home, just like I would as an outpatient provider. And I can, like I said, connect by email, by phone, by telemedicine with their provider in just minutes. And they've been more than willing at this point to take my calls or to text me. So I'm thrilled with my level of communication and the level of data I get on each patient. The psychiatric evaluation is really interesting. Like I said, a lot of times there's a comfort level with the patient. And I tell them I don't expect them to trust me off the bat. I need to earn their trust. And yet when they see me in a non-clinical situation, sitting down just like they are, sometimes the pups are with me, sometimes they're barking at me, but they know that, okay, she's listening, she can see me, and I tell them if they hear snoring, it's not me, it's the puppies. And they can tell me right away if they're not comfortable talking about something, and I can see their body language. I can ask them to stand up. I can ask them to back up a little bit. I can see if they're listening. I can see if they're looking around. I can see if I've lost them. Are they in that brain fog? Is there something else going on at home at the moment? And a lot of times that's worked to our benefit. If there's a crisis in the home, we're right there online with them. And we can address it with them to make sure that they get their needs met at that moment. And I can not only communicate with them, but I communicate with their team at the same time if there is a crisis, or I feel that they need to go to the emergency room, or we need to intervene in a family situation. So there's pros and cons, but you know what? I think through telemedicine, I've learned more about my patients than I have on an outpatient basis because it's so much easier to reach out to their family and their team at home.
That's a good story, Vicki. I mean, I think we experienced that from the insurance companies as well in terms of their reviews with our clients.
Right, and the nice thing is that I have it on tape. If I have to convince someone that I'm concerned about edema, or I'm concerned about carotid swelling, or I'm concerned about the muscle wasting I'm seeing over the last 2 weeks, I have those photographs. I have that visually to share with an insurance person, or to share with their primary care doc. So they know exactly what I'm talking about.
Correct.
Medications. This is something that, again, you're going to say, well, you're licensed. I'm licensed in 3 states. I'm licensed in Arizona, Colorado, and Florida, and I'm waiting for my California and Oklahoma license. How do you affect the patient's, or how do I affect the patient's medications? If they are in those 3 states, I can prescribe medications since I'm boarded. I have to be very careful with looking at the licensure laws in each of those states to make sure that I'm compliant. And all you have to do is go to your board and click in current telemedicine laws, and you'll see whether you're a therapist, nutritionist, or a medical practitioner, what you need to do in order to do that. We have online, and you know, because of JACO, we have information on all the medications. I have to follow them. We have to have them recorded. We need to know who's prescribing them if it's not me, and I talk to that provider. And it's nice because the minute someone has a medication effect, they can get hold of me immediately. Or if they're trying to get through to their primary care provider, or they're trying to get through to their nurse practitioner at home or their PA, sometimes it's hard. And we know we have a very anxious population that we're dealing with. And so if I can set them at ease and ask questions as things happen, it puts them in a better place. And they know that I start at very low doses. I call them lick-em doses. Some of our patients are very underweight. Some of them are, and as we know, have an acute ability to monitor their bodies and what's happening, and are afraid of medications. And I do my due diligence. If I offer a medication that's going to put weight on, I've just torn therapeutic alliance. So it keeps me on my toes, updated about the newer medications. I can look immediately at drug-drug interactions. I can see what they're taking. I can get their medical records, and I can ask the family what their experiences with medications have been. So I'm sort of that Columbo. I'm collecting data from everybody and then sitting down with the patient to decide which medication is going to be best for them. And I have a chance to answer their questions and to see visually, maybe on a daily basis, how they're responding to the medication, which is so much nicer than seeing someone and seeing them back a month later in my office. I have had no problems connecting therapeutically, and it can work both ways. I have to keep boundaries. We all do as professionals. That even though I'm on screen with them, I can't be their friend, I can't be their family member, I have to be their psychiatrist. And yet there's a informality that helps, like I talked about earlier, in establishing that therapeutic relationship. What I can do online is I can show them things. I can grab something in my office. I can show them a book. I can show them a handout. I can grab a teddy bear. I can do something with the dogs in a heartbeat that I couldn't do in an outpatient setting. And sometimes all it is to each of us grab a stuffed animal and to hold tight and do some breathing together for 5 minutes, and that will make a difference. Sure, you're listening to me now, and it's different than if I was live and I was hopping around because I don't stand still very good. But we have to be more alert. We have to be almost more aware of what they're thinking, what they're not saying. What do I need to ask about? Is there eye contact? Have they drifted off? And yeah, what do I need to do online to keep them awake? You know, when I taught, I could throw an eraser out at the students and bring them back to the present. It's harder to do on telemedicine. I'm not going to be quiet about that. It's hard. You work hard. And sometimes the patients, as we all know, can't get the energy to really keep you engaged in that therapeutic relationship, and you do have to work your hardest. But eventually it pays off. And I think you can tell by just how interactive they are some days, or their body position, how engaged they are at that moment. And do I miss anything? I'm sure I do. I'm sure there are maybe things they're doing with their feet or their hands. If I suspect, if I see them wiggling and I see their head moving, I will ask them to back up while we're talking and see what's going on. Or I'll confront it on the screen. Or I'll say, I'm hearing certain background noises, what's happening? And we can talk about it. Or if they get real quiet, they're one-to-one with me. I don't miss those things, and so I can address it on the spot. So, you know, I can see if someone's running late and they're showing me online because their little one is sick, or they've had to get a sitter at the last moment, and I'm involved in all that because usually I get to see the sitter take the child out of the room, and then we start our session. So there's a lot of perks of being on telemedicine.
Yeah, Vicki, it really seems to give you that insight into their living environment.
It does. It does.
A lot of the cover-up or the distortion that sometimes you get.
Right, and I can see how comfortable they are in that environment. If they hate where they are, we address it right away. And we decide, is there a place where they'd be more comfortable doing the therapy?
Yeah, that's good. All right, Helena, you want to take us through new treatment modality or approaches in telemedicine?
Yeah, so first I just need to acknowledge my lighting. Going back to a Star Wars reference, I'm feeling like I'm lit like Darth Vader. Luke, I am your father. So I apologize for the sunlight that I love that's now coming through the window and giving me this weird lighting. So try and be that's the creepiest part of this entire presentation, is me trying to pretend like I'm Darth Vader, which I am not. Okay, so I'm going to talk to you about experiential therapy, what that looks like and feels like in general, and also on telemedicine. I love being able to have all sorts of opportunities to do things with clients that they would otherwise not have the opportunity to experience with our team. We're going to go over session recordings and why that's so important, not only for our clients, but for us as team members and what we gain and benefit from that. And also just the importance of data. Everybody's a big fan of data, research, evidence-based, all that good stuff. But data is really important for us as a program and also for our clients when it comes to tracking treatment progress. All right, experiential therapy. So John and I talked when I first came on board. He said, you know, what do you do? I said, I'm into, I've been working with substance abuse and eating disorders, but what I'm really into is working as an experiential therapist, and I love working with horses. And he's like, tell me more. So I did. And I said, you know, I really think that we should be able to do this online and do it with telemedicine, be able to, it's all live, why not? He's like, okay, let's do it. So we have had the opportunity to go out with the clients into their community. So if we have somebody who's really struggling with movement, we encourage them to get up, move around. The nice part about being able to do stuff on your phone or with your iPad is that you can take a walk with your therapist. So when it comes to individual sessions, we really encourage our clients to engage and do things that they wouldn't otherwise be able to do in a typical IOP setting. Now, can you go for a walk with your client out in the community? Sure, you can. But there's the issue of people overhearing your conversations. The nice part about being able to do this is that we have earbuds, and our clients can, you know, hear us, and we can work with them through some things, and they can engage us in as much or as little as they feel comfortable doing so out in the community. We have a great picture of being out in the shopping center, going grocery shopping. We have done this in several different ways, and each time has been really fun and successful for various reasons. I did a demo with another clinician just because we wanted to try it out. So I did just this. We went to my local grocery store and I flipped the screen around so that she could see where I was shopping, and I would talk to her about kind of what I was looking for and what was on my list. And there were a couple people who were looking at me a little oddly. Their big concern was were they on the camera? But in reality, we are all on our phones so much that people don't really even notice. And I'm in a kind of a small town, so I think they were a little bit more conscientious of it. But as soon as I acknowledged that I'm not videoing you, I'm having a friend go shopping with me, they were like, oh, okay, that's great, you know, and they just went about their business, and it was actually pretty fun to be able to do. And again, live in real time, and so it's such a great opportunity for our clients to be able to have that experience. We had a really fun experience with our compulsive overeating group. A lot of times going to the grocery store is just either feels completely impossible or super overwhelming, and they just can't even wrap their heads around it. And when they do, they end up, you know, getting all the foods they're not supposed to get, and it just becomes this huge trauma for them. So we had our dietitian for their nutrition group go to the store, and she went around and she had her list and she showed them the labels, and she talked about the different things that she was going to be looking for and the different things that they could be looking for at the store, kind of showing them prepared foods that were already ready to go if they needed snacks. They had the opportunity to see the different aisles. They had the opportunity to go down some of those forbidden aisles that they're terrified to go down and do some anxiety management with the dietitian in live time. And that was so amazing for them. They were talking about that for weeks. I mean, they actually were looking forward to going grocery shopping that week because they wanted to try it and they wanted to see what it was like, and it didn't feel as scary. And that was just so exciting to me to hear that. I've gone jeans shopping with a client, and that was a very entertaining experience. When we got into the dressing room, I said, please put the phone in a place where I don't need to see you change, because that's not a part of this whole process. So she was able to put the phone down. She put her jeans on. She showed me, I said, please make sure you're appropriately dressed. She was. She showed me full screen, her in the mirror, and we talked about the anxiety she was having. And it was just so huge to be able to be there with her and be a part of that whole experience for her. And she even had me walk out to the car with her to make sure that she was safe. And that was kind of stressful for me a little bit, because I was worried that she would, it's like, was there a reason we're worried about safety? And she's like, no, I'm just having such a nice time with you. I don't want to end the session. So it was really cute and nice. And she safely was okay. And as soon as she got into her car, doors locked, I was like, all right, I'm going to go. Have a wonderful night. And it's just a really fun way to be able to engage and work with our clients. And it just makes it so much more personal and so much more effective for them. And then, of course, the equine therapy. I love horses. I love animals. I have 2 dogs and a cat curled up in this room right now. Thankfully, they're all being quiet, behaving. I greatly appreciate that. When it comes to working with the horses, we go out with the horses, and the clients tell me where they want me to kind of go and how they want me to interact with the horses. And they'll see me reach out to the screen and touch a horse. And it's not exactly the same as being right there with them, but you still get quite a bit out of the experience. And they get a chance to do a lot of observation and engagement on that level, and have a chance to experience something that they otherwise would never have the chance to experience. Session recording. So why is this so important? It is so great for us as a team to be able to watch each other's recordings and see how things, how we deliver information, how we engage our clients. We all have clients who are a little bit rigid or really stuck in their ways, and so sometimes it can be really hard to engage them, and you just feel a little bit stuck and you just don't know where to go with it. When you have the opportunity to watch somebody else on your team work with that same client, see how they can get them to come out of their shell, it's just such a great way to kind of get feedback for yourself and think about what you can do differently, and then really improve the experience for the client. It also allows our clients to be able to know that we are really working always to provide the best experience for them, and that we are accountable not only to them but to our team, and that there's a big feedback loop when it comes to this whole experience, and it's not just a one-off, but that we're all here to make the whole situation a much bigger, better experience for all of us. And then data. Data is so important, as we all know. We have several different ways that we track data. Our biggest thing that we're super excited about is our partnership with Stanford University. And we have created a tool in conjunction with them to be able to track specific questions about how our clients are doing, what kind of behaviors are they engaging in, not engaging in, and then we can track that throughout their experience to be able to see how are you progressing. Are you flatlining in certain spots? Do we need to be pushing you? Are you having a huge learning curve? Yeah, you're feeling overwhelmed because you've just been growing so much, and look at all these things that you're dealing with, and we can actually look at that on the data. And we can also look at it from an individual standpoint as well as from a group standpoint. The data also gives us feedback about how we're doing as a program and what we could be doing more effectively, what we need to be, what we're doing really well at, so we can do more of that. And we're also working on how we as clinicians are engaging our clients when it comes to their treatment plans and really helping them understand, you know, you've come so far. We all have clients who about halfway, 3/4 of the way through are like, I'm not getting anywhere. This is not working for me. This is a super big struggle. And then you point out to them, look at all the things that you've accomplished though in the last 5, 6 weeks. And they start to kind of look at that and think about, could you have handled, you know, X, Y, and Z different kinds of challenges that we've given you in just the last week, say in the very beginning? No. Okay then, so, you know, you are actually making a lot of progress and you are doing a lot of good things. And yes, it's overwhelming because you're working really hard. So having the data and being able to show them how hard they're working and being able to see what we can do to improve the program for them really makes a huge difference for us and for our clients. So I'm going to hit the highlights. This is, you know, when you do a CE, you're supposed to always kind of have a test of intelligence to make sure that you've been able to kind of connect to this whole process. So we just want to kind of hit the highlights for what this whole presentation has been about. And so you have some talking points and some things to take home with you. Telemedicine provides flexibility, access to experts. You can talk to me. I'm in Coeur d'Alene, Idaho, hiding out here in the trees with the deer and the elk and all that other stuff that goes on out there. And I have the opportunity to interact with people all over, and I love that. It's convenient. I mean, I am sitting here in my slippers, but I have a very nice outfit on, but I do have slippers on, and I really appreciate that I can do this work in my slippers. And that's true for our clients as well. And how huge is that? Telemedicine is safe and private. We have the opportunity to interact with clients in a regular basis. We can engage them almost 6, 7 days a week, depending on our availability and connection. And how huge is that when typically an intensive outpatient program is 3, maybe 4 times? They are private. I mean, my animals are not going to say anything to anybody. And when it comes to our clients, they have the opportunity to be in their own space. And when it comes to this kind of work and being able to connect to it, staring off into space and looking at a picture that's in your own room and then coming back and looking at the group and you're working on and engaging in something, and then you get out of session and you go back and you look at that picture, you now have a transferable object. You have something that can be at home with you as you think about things in your day, and now the treatment is sticking with you on a whole other level, and it really is amazing. So that it really improves emotional safety when it comes to our clients. And then the physical safety and medical safety, Dr. B did an amazing job of really going through the details of how we work to ensure that our clients have a safe experience both physically and emotionally. And then, of course, all my stuff that I get super excited about when it comes to what telemedicine has now allowed us to have, and as far as accessibility for our clients, and that's just so huge. You know, we have the opportunity to go on a walk with them. We have the opportunity to do things that would otherwise be super stressful. Go to coffee with a client and help them engage in what that's like and manage any stress and anxiety that comes up for them with that. We can get immediate feedback when it comes to our session recordings so that we can improve our abilities, and as well as give the clients feedback on how they're doing in their program and when it comes to their data. All right, so this is just a little baby plug for my organization, Blue Moon Mending. That is the actual CE provider. So when you get your certificate after you complete your survey, it will say something about Blue Moon Mending. That's my organization who's giving you the official CE. We are very grateful and a huge supporter of telemedicine, specifically through Bright Heart Health. So we really appreciate you guys taking the time to be with us and learn with us. And now I'm going to hand this back to John, who's going to go through any questions you might have.